Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Syafiqah Suhaimi, and today I'll be talking to you about the invisible illness called fibromyalgia. To begin, let me ask you, have you ever felt or suffered from a very, very bad flu or bacterial infection? Yeah, so fibromyalgia people, that's their reality of life, except that they don't suffer from that flu or bacterial infection for a period of time. They suffer it all day, every day, for their whole life. It sounds very horrible, but that is the reality for people who suffer from fibromyalgia. So what is fibromyalgia actually, you might ask? So it is a non-inflammatory, widespread muscle pain with symptoms such as brain fog, fatigue, sleep, memory loss, or memory issue. So muscle pain meaning that it's an non-inflammatory disease. So it affects your joints, muscles. It affects your neck. It affects your shoulders. It affects your elbows. So basically, all joints in your body. It means that your hips, your knees, your ankles, your wrists. And what's worse is that the pain signals throughout the body for fibromyalgia patients is amplified, meaning that you could have rested for about a week and haven't done anything that is like heavy duty or like very very physical, and yet your body would be in pain, and the effects cannot be seen by the naked eye, and it's very difficult to diagnose, which is why it's known as the invisible illness. Because unlike any other diseases where like if you get into an accident, you can see cuts or bruises or like scratches or something. But for fibromyalgia, there's no physical evidence of the illness, so it gets very hard to diagnose and for people to like acknowledge it. What could be the cause of fibromyalgia, you might ask? Till this day, due to the due to the lack of research done for fibromyalgia, there's still unknown. The cause of fibromyalgia is still unknown. What we do know is that it affects mostly women at the ratio of 40 to 60%, and psychological, biological, and social factors may contribute to the cause of illness, meaning like your psyche and your bio, meaning like what you eat, your diet, how you exercise, as well as socially, how you surround yourself with. That may contribute to the cause of illness. Yet again, for fibromyalgia patients, you have to keep in mind that they are what they can do and cannot do. What they can do is very, very limited. And then it could also be due to a traumatic event. And if you might ask, like, so what is the effects of fibromyalgia? What could they be suffering from if they are like, if their joints or like muscle widespread pain is that what they're suffering from? So the effects of fibromyalgia on a person could be low mental health, low quality of life, fatigue, brain fog, joint pain, as well mood and sleep issues. So for mental health, as I've mentioned before, it's very difficult for a person to get diagnosed. Most cases, it takes like up to 3 years and above for them to properly get diagnosed. So the process of going through a number of procedures and only for the doctor to say that, oh, there's nothing wrong with you, it can take a lot mentally on a person. And then for low quality of life, they can't live life like everybody else. You have to keep in mind, like, let's give an example. For if you go to a program, normal people would just be like, oh, I'm tired, I'll take a nap, and then they'll feel better. But for fibromyalgia patients, it doesn't work that way. They need to, like, a couple of days, or like if a person's fibro is worse, then they need like at least a week. And then for fatigue, there's this term called flare up. Flare up means that basically, even if you've done nothing physical, but some out of the blue, the pain throughout your body intensifies. So that is a flare up, meaning like every muscle, joint pain, and brain fog, every symptom possible just gets worse at the same time. So that is the flare up. And then brain fog is a mental slowness, and joint pain, as I've mentioned before, like the wrist, ankle, hip, knee, shoulder, neck. The severity of the pain for the joints depends on how badly a person is suffering from fibromyalgia. And then for the mood and sleep issues, usually it's because due to the person suffering from fibromyalgia, they tend to suffer from depression, insomnia, or anxiety as well. That's why usually when they get diagnosed, they would be sent to a rheumatologist as well as a psychiatrist. So, is there a cure for fibromyalgia? There are no known cures yet due to the lack of research, number one. And number two is because not a lot of doctors recognize fibromyalgia as a real illness. And how do we help the fibromyalgia patients? So, number one, it could be great to have consideration from the government or worldwide acknowledgement, because despite the fact that a majority of people with fibromyalgia are bedridden and cannot live life like other people are, there's the fibromyalgia is still not considered as a disability. So yeah, it could be very helpful for those suffering from fibromyalgia to get a disability card or approval worldwide, and it could also be beneficial and helpful for more studies to be done to help and discover more information regarding this illness to help those diagnosed lead a better life. And to conclude this presentation, fibromyalgia is a real illness that affects those suffering from chronic illness because it influences their quality of life. And more awareness and consideration needs to be extended to these people suffering from this particular chronic illness as well as other chronic illness. And more research needs to be done in order to discover more about the illness, how to help those who are diagnosed, and what we as a society can do to make their life a bit easier due to the fact that they are suffering so much. And basically, that is all from my presentation. Thank you so much for listening. And Fibromyalgia Awareness Day is on May 12th of every year. So, thank you for listening.